Commissioner of Health and Human Services. I'm not Commissioner of actually, they don't have a Commissioner of Public Health. We now have a Board of Health who actually passes all the regulations for the Department of Public Health. I oversee the Department of Public Health along with the Department of the Elderly, Youth, Human Rights, Disabilities, and the Veterans. So I've been now 3 months, September, in this new position. Prior to this, I was the executive director of the Latin American Health Alliance, which is a substance abuse treatment facility for Latino men. We opened the doors of the program in 2009, and I started this program along with Hector Reyes. We started working on this in 2004 when there was a lot of violence in Maine South, and they had shootings of at that time there was like 6-7 Latino men who were shot. And our purpose in getting together in 2004 when the mayor meeting together was how to figure out what we could do to solve some of the violence that was going on in the community. And so our plan was, we felt that substance abuse was one of the biggest problems. So we worked to put a treatment facility together for Latino men in particular, although anybody can come into the program. But the problem in particular with Latino men was that they were uncomfortable going into other programs. They didn't speak the language, they're not used to the customs, so when they would go to another program, they would only last a couple of weeks. So in 2009, we opened the residential up on 27 Vernon Street. It's a 25-bed residential treatment program where we also modeled it as a medical model. A lot of the way it was treated in the past has always been sort of the AA piece, and not that we have anything against the AA or NA piece, is that how do we bring medicine into substance use. And part of the process is thinking of addiction as it is a disease. We know it's a disease. We don't quite treat it as a disease yet, in the sense that you can't go into the hospital and say, I want a bed and I want treatment for my addiction. One of the biggest things that's hard to do is to actually find a bed. The other treatment is mental health, and that's another issue that is very difficult to get. If you want to wait for a psychiatrist, you can probably wait for 5 months or more. That's if you speak English. If you don't speak English, you're waiting a lot longer. So the two treatments that we need for substance abuse is we need more beds and we need more mental health treatment. So in the program at Hector Reyes, one of the things that we did initially was actually bring in a psychiatrist who comes in. That was difficult. It took a long time. They do a consult, so they come in once a month and they see some of the patients. We also brought infectious disease because part of the process is what ends up happening is when people are using drugs, or sometimes they're sharing needles, and so hepatitis C has gone up, and the numbers have increased dramatically over the last couple of years. It's increased 134% in Worcester overall. And HIV. So those are the parts of the programs that are in at Hector Reyes' house. We also knew then that one of the problems is that we could treat people and bring them to a program. They can stay up to 6 months and up to a year. And they do well. They do well when they're guided. They do well when they have the counseling and people actually there to give them support. Once they leave the program, it also became a problem because housing is a problem. We can't find housing. A lot of, up until recently, what did we do to treat addiction? We still say it's a disease, but what did we do for it is we treated it with incarceration. So a lot of the guys have been incarcerated for a number of years. They come out of jail, they don't have any training whatsoever, so it's difficult to get a job. They had the quarry issue, they couldn't get jobs because of that. And then just job training and education overall. So once they left the program, even if they did well for 6 months to 1 year, it was difficult to find the resources outside of the program. So what do people do if they don't have money? They resort to what they know how to do best, which is actually to sell drugs. And ultimately, when you start selling drugs, is you start using drugs. So we subsequently built a transition house next door. So when people graduate the program, they move next door. They learn to live. They learn to, have their room, pay their rent, all the finances, and get a job. while we were doing that program, we found that it was difficult for people still to maintain a job, and people would, a lot of people would hire them for, the Christmas time. UPS will hire everybody because they need it for that seasonal time, or during the summer when they need people to mow lawns and things like that, but there was never a real job. They were all temporary jobs. So it was difficult for people to pay for their apartments. So most recently, we opened up this year, Cafe Ray's. I don't know if any of you have been there. It's on 421 Shrewsbury Street. It's actually a Cuban restaurant because I'm Cuban. That something should be part of me. But we wanted to do something Latino, and it was something that wasn't in the area, but also just a place where people can train so that they can go to work on time, so that they know how to dress appropriately, talk to people, how to deal with the manager telling them, taking orders from a manager. So that is part of the program, so that they go there. The other piece that's the most interesting piece is just sort of their interaction with people, and realizing that all of you can meet somebody, you can meet me who has rheumatoid arthritis, and you can meet somebody who's who's in recovery from addiction, and what does that mean? And you realize that it's no different than me with rheumatoid arthritis than somebody else, and how do we as a community help them continue to succeed, and how do we accept everybody as part of a community, and as we say, sort of take the stigma out of addiction. So one of the reasons I took the job as Commissioner of Health and Human Services, because all those issues are in particular of importance to me, especially over the last couple of years when the rates of overdose have increased. We've had like 1,200 overdoses last year in substance abuse. We have about 4 people a day in Massachusetts die from an overdose. As you know, part of it was also getting Narcan into the police department. Narcan is what reverses the effects of heroin use. Getting Narcans into the police department, getting Narcan into the fire department, into everybody who comes in contact with anybody. And most recently, the substance abuse has been a problem that's been going on for years. It's nothing new. Overdoses are certainly much more frequent now, and that's because there's a lot of fentanyl in the drugs. Fentanyl is a very strong, potent opioid, and they're lacing the heroin with that. But also, it's also starting in the white community, white middle class, white upper class community, mostly because back in the 50s they started putting OxyContin around, and OxyContin is a very strong painkiller that they thought was non-addictive. And for everything that we can imagine, from acute back pain to headaches, it was given to people, and it was given to people in prescriptions of 60 to take home, and kids started to abuse it. And then what happens is it's, after a while, when the doctor is not going to give them any more Percocets, what ends up happening is, what's the cheaper mode, is you can get heroin for much cheaper, and people started using heroin. And that's when we started to realize that this is not just, people can stop. This is really a disease, and how do we treat this disease? And so the community overall is working together. We are all working together to help with this epidemic. We're bringing Narcan into the community. We are trying to work with the hospitals, with the doctors, to really write prescriptions for 3 days and no more than that. And if they need more medicine than that, then they should be followed up, instead of having this increasing amounts. How do we dispose of all this narcotics that we have in our medicine cabinet? So you can now go to the police stations and different areas to dispose of your narcotics. We're trying to get more mental health into the area, so we're trying to speak with the insurance companies and see if this is something that we can bring about. This was sort of an epidemic we had even with primary cares. They were sort of phasing out. Most people were going into specialties because they weren't paying primary cares enough, and so same thing is happening to psychiatry, and it's sort of dwindling down the side. So how do we bring those pieces back? The other piece is bringing recovery coaches into the emergency rooms. When people actually go into the hospitals, for example, if they have pancreatitis, pancreatitis is caused by alcohol, and we will, in the hospital, we'll take care of the pancreatitis and we'll send you home without, the pain of pancreatitis. But what do we do about the guy who came in because of the alcohol that caused the pancreatitis? People who do use opiates will have kidney stones. We'll take care of their kidney stones. But what brought them in, which was the opiates, we're not taking care of. Bringing recovery coaches into the emergency room and into the hospitals are people who can guide the persons who are there, or somebody who comes in with an overdose, of how to get treatment and what things are in place for them so that they continue, because it's not something that the hospitals do. And that's the process that the hospitals are trying to change in that process. So our goal is obviously to improve what's happening. I think attached with this that we're also working on is the issue with homelessness. And most people who start using narcotics are always doing pretty well, and ultimately, because all their money goes into using narcotics, end up being homeless. And so that's also part of what I'm doing in this city to help with this. But I also wanted you to meet Jonathan Oliveira, because I know my time. Oh, I have time. I can sit here for a while and talk about all of that. I'm just going to introduce you to Jonathan Oliveira, because I think that our perception of what we think about addiction and the old story is people just can't pick themselves up by their bootstraps. And if we truly look at this as a disease, I always tell people, I actually talk about sometimes how our system doesn't work. We had some graduates who graduated the program. They were there for a year. We couldn't get them an apartment, partly because they didn't have the income, they didn't have the even the wherewithal just to get a job. They had a lot of mental health issues, but they would not. In order to get some type of grooming, they had to go to the triage center for 2 weeks till they found somebody till they got housing. And consequently, one of the guys relapsed. And I think to myself that if I was in a triage center and somebody put a bunch of donuts in front of my face every day, I would certainly start eating donuts also. And it's part of, we look at addiction as something as, from drugs as something very different than addiction of somebody who's using, anything else, whether it's food or anything else. It's all addiction, and it's all, it is all a disease, and how do we deal with the disease? So I want you to meet Jonathan Oliveira, who actually is a resident at the Hector Reyes house and also works at the cafe, and he can tell you a little bit about his life and where he is now.
Good afternoon, my name is John Oliveira, and I am in recovery. Like Dr. Matty was saying, I do suffer from the disease called addiction, which I didn't know I had a disease growing up. And I come from a family where that's fine. I come from a family where I was brought up very, very normal. Nobody suffers from this disease, and growing up, in my teens, I tried my first drug and I fell in love, and I couldn't stop. And going through my 20s, my family couldn't understand it. My family didn't label it as a disease. They labeled a drug addict or an alcoholic somebody who was living underneath the bridge with a brown paper bag. And they didn't want to believe that their son was addicted to drugs, and living my life and always getting stigmatized as being different made my addiction worse. It made me not want to be around people, normal people, and growing up it was very hard. And then I started going into detoxes and stuff and started learning about this disease that I do have, and that there is no cure for it. It's just like somebody has cancer, they need to get treatment. And for me, it clicked into my head that I needed treatment. So fast forward, I'm 34 years old today, and I don't go by Jonathan as a drug addict. Today I'm a father, I'm a husband, I'm a normal person. with a disease that needs treatment. And I'm part of the Hector Ray's House, and it's a beautiful program because it just doesn't, like Maddie was saying, it doesn't just throw AA down your throat and NA. The house helps us deal with real life issues, anger management, parenting classes. Working at the restaurant is beautiful because we get to interact with everybody else. We're not just in a corner separated from the rest of the world. We are just like everybody else, and going to the cafe and working there gives me, I'll speak for myself, it gives me sometimes to just clear my mind. Sometimes to just interact with people and get back into the work field, and it's helped me out a lot. And this disease thing is for me, I'll speak for myself. I used to be embarrassed to tell people because the way people would look at me, the way people would treat me, the way people would automatically label me as something else. But today, I understand what I got. I understand that it's a disease that needs treatment, and it's very scary. If you look at the news, we're losing a generation. And it's, I look at the news and it's scary because a lot of people don't want to talk about this issue. A lot of people just want to put it in the closet. It's a very touchy issue. I'm speaking like that because it was, growing up, my family was like that. My family owns a couple businesses, and they're pretty well known. So for their son to be a drug addict was pretty embarrassing for them in the beginning. So growing up, it was very hard, and that made my addiction even worse because now I can't really talk about my addiction because I'm not one of those people, my family always used to say. And like, I could stand here today with my head up high, right, proud and full of confidence to say that, my name is John Tauber, I am in recovery. I am a good person. I'm not a bad person trying to get good. I'm a sick person trying to get better. So for me, I totally agree with treatment. I'm a proud member of the Hector Ray's House. I'm proud to work at the cafe. It's helped me a lot. It's not just, I come into the house with a substance abuse problem, but because I've used drugs, I've also had problems in my whole life with anger and with relationships and with just how to talk to people. And the house helps us with all life issues. So today I'm very teachable. I'm willing to learn because I look out there and everybody's dying, and I believe that as just like every other human being, I am worth people give me a chance. And I believe that treatment for people like us is the goal, because like Dr. Maddie was saying, it's just like any other disease. We say it's a disease, but like she was saying, you can't really go to an emergency room and say, I'm a heroin addict, I need help. There's nothing they can do for you. And that's very sad, because if all the people that suffer from addiction, if half of them could feel the way I feel today, because a year ago I was, my parents were planning my funeral. And if they could just have the feeling that I feel inside today, it's a beautiful thing. I just want to thank you guys for listening, and thank you very much.
Does anyone have any questions? Question in the back.
Hi, I'm Ellen, and I was just wondering, it could be to both of you, but Jonathan, that was really great. You speak to the pain that is in all of our lives. We just all handle it differently. That happened to be yours. Other of us have other things that maybe you can't see, but we carry them. So you are one of us, and we are one of you. What is the pain is there a general pain that the opiates who are trying to recover or want a life, what is that pain? Because we're all trying to numb that pain usually, whether it's alcohol, whether we're chatting too much, whether we get sick or whatever, that we're all fighting that pain within us. Is there a common pain? Is it self-worth I heard from you? What is that we could learn to love as well? Because you're part of our community.
My pain on like why I started using, or?
Yeah, what was that pain in you that was,
You know, I can't pinpoint and say I started using drugs because this happened in my life. But I could honestly say, like, growing up, I could be in a room full of people and still feel alone. And
Felt separate.
once I started putting drugs into my system, I felt normal, better, or good, or high, whatever you want to call it. And then, so long of using, you know, I couldn't have fun without having drugs in my body. And something about opiates too is like once I was really into it, trying to get off of it is a whole other level of real physical pain and people not understanding, and me not understanding what my body was going through. So, and having to go, so then it turned out to wherever I needed to go, I needed to have opiates in my body because you know, I wanted to fit in.
so to reframe that, I think you started with your feelings, so it's feeling part of a community, really, which is what they're finding out with a lot of this, is you've got a community to go to, and maybe, is it Matilda?
Yeah, no, I just wanted to say, at least some of the data from the program is that a lot of people start using, they start with marijuana, cigarettes and alcohol, and at 13 years old, there's actually data that they start at 8 years old now using drugs. And a lot of it is exactly what he said and I want to say some issues of depression, mental health issues, and this goes back to, are we looking at these issues and are we treating these issues? There's also a lot of trauma in a lot of the guys in the program, for whatever reason, from whether the family was also using drugs. He's not in that situation, but there is a lot of that, you know, abuse, any of those things, but a lot of it also is a big part is a mental health component, and part of it is people do start at that early piece, and so from that early piece, there's a group that fades away, but there's a group that realizes that makes them feel better, and they continue through that process.
Mental health is good, thank you.
Commissioner Castiel, I'm Aaron Pace. I'm the minister at the Unitarian Universalist Church over by Bancroft School. One of the issues that I think that the public is not as aware of that we could be is the wealth of unfunded mental health and medical mandates that are passed by either the state congressional delegations or by the federal government. I wonder if you could speak to what we can do as citizens to encourage the people who represent us at the state and federal level to actually fund the public health and public mental health mandates that would make for more beds, more clinicians to assist with treatment, more opportunities for people to find their way into a house like Hector, and how we as a community can begin to be your best advocate in this work.
And that's a great question, when I started, I said that substance use has been an issue that's been going on for a number of years. And the only reason that I'm here today and that we've been talking about it, not only that the numbers have been going up, is that people have been advocating for it. Now it's affecting families everywhere. You will know somebody, a friend of yours, somebody that has been suffering with the same thing. I mean, if we're talking about 4 deaths a day in Massachusetts from heroin overdoses, it is affecting everybody here. So I think that's the biggest piece. I mean, that's why I'm at the city working to talk to, if we can get insurance companies to start paying for this process and making this a priority. And if we talk about that this stuff is happening with kids, you know, I talked to psychiatrists at UMass who will say that a kid will come in, you know, 7, 8 years old with a psychotic episode and they were 2 days hospitalized and out they go. We're not looking at those issues. And then this whole piece about beds, it is, you know, they started that program in Gloucester so that, you know, the police department, so that people can just go there and say, look, you're not going to incarcerate me, you're going to give me treatment. And they spend hours looking up just to get a bed. You know, they have a list of phone numbers to get beds. That shouldn't be our system, that should happen. We should be able to access a bed if people need treatment. And those are the things that we need to really, you know, talk to our politicians, anybody who can help us with this process. But number one is mental health treatment from youth on, that should be readily available. You know, people say don't talk about Europe, but there's no country in Europe, who, you know, progressive country in Europe that you can't access mental health, and we can't access it here. And beds are certainly, it should be that when you want treatment, it should be readily available. How it works right now is you call, and they'll tell you there's not a bed there. What Worcester does is they call every minute, just nonstop, because somebody will leave at some point. But if you're going through the midst of addiction, and you don't have the wherewithal to sit there and start making the phone calls to see what place in Massachusetts has a bed for somebody, and that's where it has to be an easier system where he says, I'm going to the hospital, I'm a heroin addict, I want treatment, it should be available. Any other questions? Thank you very much.
Well, thank you very much. And, I have to be there.